Welcome to Community Watch, and today we have an interesting story about vaccination. We'll be joined today by Dr. Christopher Hall from Berry College. Stay tuned. Community Watch starts now.
Welcome to Community Watch. Greg,
Doc, how you doing, sir?
I'm all right. How are you?
Oh, I'm not one to complain too much.
Only privately. Only privately. Not on television very much.
True, I will agree with that.
Well, I'm glad you're well, and I know you are as interested in the conversation with our guest today as I am. We've uh, convinced Dr. Christopher Hall to be back with us from Berry College, professor of biology, and we appreciate you being with us. Welcome to the show.
Sure, thank you. Happy to be here, and thanks for having me.
Well, we had mentioned the last time you were on the show that we wanted to have you back to talk about vaccines, and I think
hmm
at the time I had in my mind that we would have a conversation kind of generally about vaccines. I know that's one of your areas of study.
True.
Um, so the current situation, though, kind of brought up vaccines um, more immediately.
Right.
So we definitely wanted to have a conversation with you about it. Um, so um, right now we have two vaccines that are approved and being given, others potentially on the way, um, and a lot of controversy about these vaccines. And I guess the place I want to begin is just simply your impression about how safe these vaccines are and whether or not you think people should be setting aside their concerns and going forward as soon as they can.
Of course. Well, of course, I'd like to start by pointing out that vaccines have saved millions upon millions of lives worldwide. And the technology, although some of these technologies for the COVID vaccine are somewhat new, the formats that they're using have been used for a couple of decades now in animal models and in uh, other formats in which they've been experimenting with Zika and Ebola. And I don't think there's any real cause for concern over these vaccines more than there would be any other. And as I said, vaccines are a proven public health tool for, mitigating outbreaks and preventing disease. So personally, I'm in line to get the vaccine. As soon as they tell me I can get it, I'll be getting it. I do not worry about these vaccines that they're putting out for COVID right now. It's not that they haven't been tested for safety. It's just they haven't had the years of testing and the expense that most vaccines go through. And let me point out one thing about that is that these have been put to the forefront because of the immediate need. Most vaccines, the need for them is not that immediate. So they can take their time and to go through these trials at a sort of a snail's pace, if you will, working with the FDA. But the animal models that these have been tested in, as well as previous data, just doesn't cause any red flags to pop up for me.
Dr. Hall, as
Go
we're
ahead.
talking about vaccines and we're moving forward in the process, I hear a lot lately about new strains of this virus. How significant is that with regards to vaccines that are currently being administered.
You mean like the Moderna vaccine and Pfizer?
Yes,
Those
sir.
are
With the new strains of viruses
right.
being prevalent now.
Let me drop back a little bit and talk about what a vaccine does is, of course, stimulate an immune response that when your system, when your body sees it the next time, it's already primed for it. It's a much more vigorous response immunologically against that pathogen. Well, one of the unique things about the Moderna and the Pfizer vaccines is the fact that these are messenger RNA molecules that code for just the spike proteins that the virus has and uses to enter your cells. And they're both very similar. The nice thing about that messenger RNA vaccine, it can be ramped up and made very quickly. So getting to your question, if different strains presented problems, it's easy to synthesize the messenger RNA for the different molecules on the surface of these new strains. And so you can combine and make what's called a combined vaccine with these spike protein messenger RNA molecules that ultimately could be protective against multiple strains. That said, right now the Moderna vaccine in particular, and I think the Pfizer vaccine of both, they've shown cross protection with some of these other strains. So even if they weren't as effective against one strain, having some cross protection would ideally, or at least give you some protection against those. And then you can manipulate these vaccines much more easily than you could the old vaccine technology. You can manipulate these to include those messenger RNAs for different strains. So you would get a vaccination against 3 or 4 or 5 different strains. The flu vaccine that we get every fall has 4 different flu strains in it because of this same unpredictability, right? So, but the reason we have to get a new flu vaccine every year is because we've always got these emerging influenza viruses, and we having to predict a year ahead of time which ones will show up. We may find ourselves in the same boat with COVID. If we get a number of strains that pop up different years, we may just have to combine an influenza vaccine with a COVID vaccine. But yeah, the different strains are a concern. And I think that, that's certainly something they're paying attention to and looking at. If you're infected with one strain or you get vaccinated, you develop immunity to these other strains. And some of it's partial immunity, I'm guessing, but they haven't really talked about how protective they are against these other strains yet. Does that answer your question, Gregory?
It did. And it leads me to another question. So then it's so I guess in my mind, and I'm thinking probably a lot of other people, I still have this idea that we'll get to some point of immunity that we can kind of go back to normal. But as I'm looking at some of the other articles, is it a possibility that, we'll be dealing with COVID for years and years, like the flu, it just won't be as deadly, may not be as contagious, but it'll be some form of COVID that we're dealing with that may require annual shots?
Yeah, I think that's a legitimate concern. I think like with influenza, again, we see new strains emerge. We have to get vaccinated every fall for the new versions of the flu. And that might well happen with COVID. Of course, COVID's related to SARS and MERS, other respiratory viruses we've seen before. COVID just happened to be more communicable. It's more infectious. So I think it's legitimate to think that we may be dealing with this for years to come. But to be honest, there's nothing we can do about it. If we have to deal with it, we'll deal with it. And I think the format for some of these new vaccines, particularly what we're talking about, these lipid nanoparticle mRNA vaccines, lend itself very well to being able to vaccinate against multiple strains at once they figure out which ones are coming. And the technology's come so far so quick, largely because of the amount of money that's being poured into COVID vaccines. I think it's legitimate to think that the technology will hopefully prove to be extremely useful and flexible in terms of these new strains.
You know, I was thinking about the news, I guess, from yesterday that South Africa had stopped their vaccinations because the new strain was not being treated adequately by the vaccines that they are using. And I just wonder about all the different kinds of vaccines that are being created and given out in different locations around the world. Is that how common is that to have so many different kinds of, and they've got to be, I'm assuming, dramatically different types of vaccines?
Well, the manufacturing processes can be different. The delivery systems, it's sort of like the Johnson & Johnson vaccine uses a non-pathogenic virus to deliver the messenger RNA or deliver the signals or the blueprints for the proteins that the immune system will recognize. And yeah, there's going to be certainly some of these vaccines are not going to be as efficacious as others against certain strains. And it's going to have to depend on what are we teaching the immune system? When we give this vaccine, what proteins are we targeting? And mostly we're targeting those spike proteins the virus uses to get inside the cells. And that's a legitimate way to approach it. I think what we will have to do is look at what are called multivalent vaccines, which can one vaccine that targets numerous different strains. And of course, right now, we're just trying to stop this and at least slow down the progression, reaching what sort of Gregory alluded to a minute ago was herd immunity. Trying to get enough of the population resistant or immune that we break that chain of transmission between people, or at least reduce it. And of course, vaccines are by far the most effective way to do that. And we've got some learning to do. We're going to have to catch up with the virus, but I'm very impressed with what some of these biotech companies have done in terms of a year ago, we did not have anything like a vaccine for COVID. And in a year, we've got, I think, over 50 vaccines that are now in trials. So I think what you're going to see in the scientific community is going to collaborate and share information to generate the best vaccines possible. And we may find that in one area, South Africa, this vaccine works better. Another area, we got another one that works better. But until we combine those and have a universal vaccine against COVID, yeah, we're going to be putting out these little fires, but otherwise we got a forest fire burning around us.
Can you help us understand why it is that the Moderna vaccine requires or it has to be kept cold?
Right.
The Pfizer vaccine has to be kept extremely cold.
Right.
And the new one that Johnson & Johnson is working on won't require any.
Yeah, it has a bit to do with the format of the way it's built, because the Johnson & Johnson vaccine is actually a virus that they've taken. It's an adenovirus, usually something like a cold virus, that they have taken the genome out and then they've put the molecules in there that'll code for COVID spike proteins. And let me reiterate that that doesn't mean you're getting infected with coronavirus. You're just getting some messages for small pieces of proteins for the immune system to recognize. But this is a more stable vaccine than the Moderna and the, pulling a blank, but the other two, yeah, the Pfizer. So, because those are lipid nanoparticles. They're basically like fats or waxes with the messenger RNA embedded in it and some molecules on the surface to allow it to get into your cells where it gets unpacked. The trouble is those messenger RNA and those lipid molecules require colder temperatures than that adenovirus would. So,
all right, we're coming up on our break, so don't go away. We've got a lot more discussion coming. We'll be right back.
For 50 years, Georgia Highlands College has been a community that takes charge. At GHC, we have a mission to provide access to an outstanding education, meeting the career needs of the region, and helping our communities thrive. Every student we graduate becomes a celebration we never forget. We are more than Chargers. We are Chargers taking charge for 50 years and beyond.
Welcome back to Community Watch, and we're having a conversation with Dr. Christopher Hall of Berry College, professor of biology, about vaccines, particularly COVID vaccines. And Dr. Hall, you mentioned and Greg brought up the idea of herd immunity, which is something that has been discussed off and on all year, the past year. If we did not get vaccinated, if people, and there are quite a few people who are deciding that they will not get vaccinated for a variety of reasons, which we can also talk about.
Mm-hmm.
Herd immunity would still happen eventually as COVID went through the population.
Right.
Why is it, or would you say that creates a problem to wait, or vaccinations are important to speed the herd immunity up?
Oh, no, absolutely. Yeah, because if you're going to wait for people to get infected, now you're talking about more people dying, right? That you're taking your risk if you're willing to wait till you get infected with COVID to find out how you respond, and is it going to be severe? Is it going to be a mild form of disease? And of course, the vaccine is going to produce at most a mild form of disease, and mostly the reactions have been similar to what we get when we get a flu vaccine. We get a little pain, maybe a little inflammation at the site. You might develop, particularly with the Moderna vaccine, people have had a little bit, may not feel great the next day, like they have a mild case of the flu. But one thing I'll mention is it's a whole lot worse than the alternative. And it shows that your immune system is recognizing those proteins now and responding to it. You're producing antibodies against the virus. Your T cells are responding to the virus. So you're generating a good immunity. With a natural infection, we're not sure yet how long your immunity would last if you get an infection and clear it, survive it. We're not sure what the duration of that is. I'm expecting that the vaccine is going to provide you better immunological memory than the natural infection might. But right now we have to wait and see, because of the nature of the way we're injecting the vaccine and the way it makes its way to the lymph nodes, which is really what we need to get going to make a good, strong memory response for the immune system. So I think it's important that, one, why take the chance with how are you going to respond to COVID? But two, the quicker we reach that herd immunity, the quicker we're going to watch this disease start to decrease in prevalence, and the quicker we can get back to normal. And I think that's all of our goal. Let's get back to some semblance of normal. And the quicker we get there to this herd immunity, as we keep calling it, the quicker we can start, opening our restaurants and getting back to classes and things that we all want to do.
Dr.
That
Hall,
vaccine, a good vaccine program is going to get disseminated much more quickly than just waiting for infection to spread.
Dr. I don't want to get too far off the talking about vaccines, but something has come to my mind. I know recently and lately we've been seeing, and some people are recommending wearing 2 masks. I know they have new requirements for some masks that are 5 layers. And so I'm just assuming everybody's learning. So even the manufacturers, even the biologists, people are learning, we're learning more. So is that the case with masks? Is that now we're seeing that, yes, anything is better than nothing, but there's this
Right.
different level of, I guess, security for the virus itself, even as it relates to masks.
Yeah, I think that's true. Of course, masks have almost been, people have almost forgotten what their purpose is. In some ways, they're getting so creative with them, and now they don't want to restrict breathing and things like that. But yeah, I think you can up the debate on masks and how thick they should be. And of course, the N95 masks are just not available to everyone. But anything, like you say, is better than nothing. And as far as guidelines, I'm just happy if people are wearing a mask of any kind. But of course, with more layers, you're getting more protection. And as well as you're protecting the other people around you, like we had in the conversation in the fall. I think right now, if they want to increase the mandate for how thick or, the particulate transfer of a mask is, that's fine. Let's make sure, though, that it's worth doing. I want to see the data on whether those sorts of changes are really helping, because, that does, if they're increasing the thickness, it might increase, how respiration occurs a little more than what we've seen. People that are out walking around, if they start to feel like they're, having to breathe through too much, they may just throw it away and not use it. But I mean, right now, Barry, we've had a very nice policy with the masks that are available, and kids have gotten very creative and use them as, fashion statements and things. And we've done very well over here with, our students following protocols and guidelines, and we've been able to stay in class, and I think that's been to everybody's benefit. So hopefully the masks that we got are helping. I'm sure we can always improve on them, but let's just see that there's some real data to show that they are better. I haven't seen it, but it may be there.
I want to get now, and this will be it, Doc. I want to get back to the vaccination itself and the vaccines. So why are there such a shortage? Because we keep hearing about. It seems no one knows exactly that there's a breakdown in communication from the federal government, the state government, even to local level. Really, the proper flow of how vaccines will be delivered and when they will be delivered, when delivered. So what's the breakdown with it?
Yeah, so it's become very complicated, and this is something I think they're working on diligently now, is that once the vaccines are made available by the company, Pfizer, for example, they get shipped out based upon, allotments to the states. And of course, now it's up to the state departments of public health to determine how these get distributed. And that's where you've seen a lot of controversy, how those decisions are being made. And I think they're trying to nail that down. I've heard the federal government's trying to take more control of it. Apparently, a couple of million doses of vaccine kind of up and vanished. No one knows where they're at, and they're trying to track them down. And of course, the supply end of it is limited by how much can these companies put out, because they've got other products that they have to make with it. But I would guess that our biggest problem is making sure that we get these vaccines delivered. And as you pointed out, that the chain of say cold, what we call the supply chain or the cold chain, is maintained so these vaccines stay viable. Again, with Moderna, like you pointed out, and Pfizer, they have to be kept very cold. And the last thing you want them is to sit out somewhere and get warm, and then you have to throw them out. So I think we're going to have to get tighter controls from the manufacturer out to where we're doing the injections. Right now, it seems to be somewhat state dependent, with some states doing very well. West Virginia has, kind of exceeded expectations in this regard. Other states are just not controlling the supply too well. So I think we're going to have somebody sort of step in and oversee this to make sure they're all distributed in equitable and fair and safe way. If that answered your question.
It does.
So Dr. Hall,
Yes.
on a broader scale, why is it that so many people feel that vaccines are dangerous, that they so many people refuse to consider them? That's true with this
Right.
vaccine, but any vaccine has been the case.
Right. And, you know, I think it's like a lot of things. There's a lot of misinformation. Frequently, I heard from a friend or a friend of a friend, again, that sort of, rumors that people state as facts that aren't necessarily based in facts. Again, some people do have reactions to vaccines, and usually it's an allergy to either a carrier or a bulk molecule in the vaccine that helps stabilize it, or like I said, when you go in to get a flu vaccine, they actually ask you, do you have an allergy to eggs? So somebody who's allergic to eggs maybe not have known it, gets vaccinated, and suddenly they feel terrible. I think it is a lot of misinformation. I know Johns Hopkins currently, their most recent survey said that about 63% of people that have been surveyed want the vaccine. You've got a smaller percentage that wouldn't take it. I think it was less than 10% said they wouldn't take it. And the rest are undecided. But we're going to have to get up around that. We need somewhere around 70, 80% of people to be immune. They don't have to be vaccinated, but if they were infected and cleared the infection, they can be considered part of our immune herd. But it does puzzle me why, with all the safety data that we've got on all these vaccines we've gotten since kids, with the very rare occurrence of a bad reaction, why you would take your chances again with getting COVID, particularly if you fall in one of those demographic groups considered at high risk, those with, an autoimmune disease, the elderly, any of those with, these underlying predispositions to significant, pathology due to COVID. I just can't imagine why you wouldn't get it. Again, I know at least 40 people, friends of mine, who have already been vaccinated, many of them in the healthcare community. And at most, they've had a mild reaction. One had some flu-like symptoms the next day, but they were up and around. They just didn't feel great. But the vast majority of people said, yeah, I had a little itching, swelling at the injection site. But beyond that, it was gone the next day. So if that's all the reaction that I'm going to suffer, put me in line. I'm signed up to go get it. I mean, I'm happy to. I just think that there's just way too much, there's distrust and misinformation that I think is, especially when we're talking about these vaccine campaigns that are unwarranted. We saw an outbreak of mumps at Disney World because a group showed up that they were against vaccines. So they weren't vaccinated, and all of a sudden we had another outbreak. So I feel like we're protecting the whole society by signing up to get the vaccine.
Well, I think the issue of trust is a discussion we'll have to have sometime. It's
Sure.
we don't really have time for it on today's show, but I know
I'll bring a psychologist then.
we might need that too. Well, thank you so much for being with us and helping us understand these vaccines a little better. And we appreciate it. We'll probably bother you again in the future.
Happy to, anytime. Good to see you guys again.
Thank you so much.
Sure.
And thank you all out there for being with us on Community Watch. We'll see you next time.